Hey everyone, in this video I'm going to talk about why hip positioning matters for labor and for birth. So if you are pregnant and you're really wanting to learn how can I best prepare for labor and for birth, it's really important to just educate and inform yourself about pelvic anatomy. So our pelvis here has the ability to change shape. So a lot of people think that the pelvis is a rigid structure, but actually it can actually open on the top, open on the bottom, it can rotate. So there's lots of mobility that can happen in the pelvis. So you really want to take advantage and really learn how can I best open my pelvis to create more space for the baby so that maybe you can allow labor to progress more smoothly. You can decrease pushing time, you can decrease the possibility of a medical intervention. So really learning what can I position, or how can I position my body, whether that is in a squat position, hands and knees, hips internally rotated or externally rotated. Really learning about that can be really helpful. So we're gonna just play around with, understanding how our hip position affects our pelvic openness or closeness. So if we want baby to drop into the pelvis, so let's say we are in early labor, we want to open up the top of the pelvis. So you can see you want the top to open up so that the baby has room to drop. If this space, if this little inlet is very rigid and not able to open up, that could prevent the baby from dropping into the pelvis and prevent labor from progressing. So it's really important to note that actually positioning your hips into external rotation, so you can think about it as like knees further apart, feet more together, actually opens up the top of the pelvis. Now this video is going to go a little bit more into how can we open up the bottom of the pelvis. So how can we create more space at the bottom so that baby has more room to exit. So this is where I'm going to have you get involved a little bit. So what you're going to do is you're going to put your hands underneath your sits bones. So if you put those hands underneath your bones, you're basically putting your hands underneath these two bones right here. So we have this one and this one. So you're going to be like almost like cupping your sits bones. Okay. So I'm going to have you cup your sits bones. And we're just going to do a few movements because I want you to understand how changing your trunk and hip position changes your positioning of the sits bones, because we want those sits bones to be able to widen to allow for birth. So again, these sits bones, we have the sits bones right here. We want these guys to widen to create more space. If you can see that, we want them to widen. So we want to understand what can we do in our body to make these sits bones go away from each other and to help lengthen the pelvic floor. Pelvic floor muscles are located right here. So we want to lengthen them, elongate the muscles. Okay, so going back to sitting on our hands, I'm just going to have you bend forward and then you're going to bend backwards. So kind of feel like what happens to your sits bones. Do that a few times. So you may notice that bending forward or trunk flexion actually causes the sits bones to go apart a little bit. So that's good because it helps lengthen the pelvic floor. When you lean backward or trunk extension, that causes the sits bones to draw closer to each other. So that's important to know. So when we're delivering the baby, we want to make sure we're in trunk flexion. So that can also look like bringing the hips or bringing the knees towards the chest. So basically creating a smaller angle between the knee and our trunk. Now we're going to play with our legs. So I'm going to have you internally rotate your hips. So you're going to have again, you're still cupping your sits bones. You are going to have your knees come together, and then you're going to have your knees come apart. Knees come together, and then feet together and knees apart. And again, just feel what happens. Do that a few times. And what you'll probably notice is that those sits bones widen as my knee are together and my feet are apart, and that the sits bones come closer together when my knees are apart and feet are together. So you want to take advantage of this hip internal rotation. That's going to help lengthen the pelvic floor and open up your sits bones to create more space for the baby. So if you are delivering on your back, you may want to consider, how can I need to position myself so that my knees are towards my chest, but also that my hips are internally rotated. So whether you are laying on your back, on your side, think about, how can I position my legs, my trunk, my knees, my ankles, so that I'm doing as much as possible to create space in my pelvis. So I hope this was helpful. Again, this video doesn't really go into like specific labor positions, but I wanted you to get a good feel of understanding the pelvic anatomy and how that affects the pelvic floor and how wide the pelvis can open. Now that you know this as well, you might be thinking, like, what kind of exercises can I do to help promote more hip internal rotation so I can help lengthen my pelvic floor? And that's a great question. I will link down a video below just going over a few more additional exercises you can do to help lengthen the pelvic floor and to help promote hip internal rotation. So I hope this video was helpful. Let me know if you have any questions in the comments below.